Have you guys been given this exercise for your lower back pain, but you really feel like it's not really working out too well for you? Are you experiencing pain right into this area or into this area? Well, in this video, I'm going to show you a really simple modification for this exercise, which is going to make it actually work better for you and make it so it doesn't actually hurt as you start to do it. I'm Sebastian at Performance Place Sports Care, part of the locally world-famous chiropractors in Costa Mesa, California. In this video, we're going to go over the Deadbug exercise. At any point in time, you feel like, hey, what the heck? That seems like it really works for me. You wonder why? We have a webinar that's going to pop up in the corner that I want you to take advantage of. It's a lot of great information about how to figure out how to manage your problem and pick the right care for you. So it's always going to be there. It's free. The Deadbug, right here. Normally, the biggest problem that I see people when they do this is when they get to the long stages of it, when they're going long and long, they tend to feel lower back pain at some point. It feels like it's just kind of working hard. And the issue is that when you get to the long position, and if your back is unrooting itself from the floor, your back is working more. We call this an extension compression stabilization system. You're making it so your lower back musculature and also the little joints of your lower back are working harder because your core is insufficient. Your front wall is insufficient, your anterior chain is insufficient, and also we can say oblique sling, we could say intra-abdominal pressure, whatever. Overall, the core is not working well. It doesn't mean it can't, it just means right now it's not. So the easiest thing to do is just regress this exercise. Don't make it so the arm and leg thing is going on. And quite honestly, when people do that, like you saw when I started this video, I had to think about which arm and leg I wanted to do. Usually it's taught with opposing arm and leg, but in this case, I wouldn't really care. Just do something slow and painless, okay? So here's how we're gonna do it first. I want you to first try to push your lower back towards the floor. Imagine there's like a blood pressure cuff there, and at any point in time, if you're looking at the blood pressure cuff reading, it doesn't actually lose pressure. Some people actually do this with a blood pressure cuff to give a little bit of feedback. They read it. Okay, so as you start to lower your heel down towards the floor, you shouldn't see any change in the cuff pressure. Okay, if you don't have a cuff, one thing you can do is actually put your hands right here as a little bit of a feedback tool. If you feel the pressure in your hands start to change, you're losing pressure. Don't lose pressure, okay? That's option one. Option two, if you're going really long with your foot, this is hard even for me, all right? Keep it closer, okay? No shame in the game. One fault I see with people is they tend to kick. You notice my hips aren't moving? Usually it's just it's like a little bit of a step down, if you will. After you get the lower half down, you can go to the upper half. And just do the upper half in a part and then put it all together. So, same thing applies. Pressure. Go ahead and reach your thumb as far as you can over your head. And same thing here. Okay? My tree's in the way, but don't mind it. I want to see if you can actually get full range without your back unrooting itself from the floor. This is a really nice exercise that gives some insight about things that may not be working well and contributing to your back pain. If you notice that you say you got a frozen shoulder on this right side and you're reaching up like this and you're going like that, probably most things that you're doing, like reaching over like onto a countertop or on top of a fridge or on a shelf, you're going to be probably extending your spine, which tends to bombard the spine with a lot of effort and a lot of insult, and it might just hurt. And so maybe doing things in a little different way might be the answer, or we resolve this frozen shoulder. And you can do that with rehabilitation as well most of the time. Okay, so you're gonna do the top half. And then we're gonna go to both halves, all right? So whole movement. So pressure, arm and leg, I don't care if it's same side or opposite. Do whatever feels easiest, simplest to you so you're not focusing on the movement of the arms and legs, because all I want you to focus on is, do you have pressure, okay? After you get the hang of it, you can do opposition if you'd like to, okay? But at no point in time do I really want the movement, like thinking, oh, I need to do it this way. I need to do it long. I need to do opposing. That should not take your attention away from the pressure component. If you lose the pressure component, all bets are off. This exercise is completely useless to you and me if I was working with you. So if you'd like to work with me or Don, reach out. We see people virtually or in person, and as you can see on video, we can see movement deficiencies on video. We can see compensated movement, and we can see what you're doing and coach you out of it. It's not a problem, all right? So if you'd like to work with us, we do virtual or in person. In person is always best, but virtual works really, really well. And don't forget to take advantage of the webinar that we have for you. Subscribe to the YouTube channel. We have probably over 500 videos on various topics, from low backs to hips to hamstrings to shoulders to fingers even. We have lots of things. So subscribe. We'll see you guys next time.